The 30-year legacy shows me that the people who put this together were forward thinkers, and they had the hand of God guiding them.
Chapel Hill United Methodist Church is a charitable organization. We've always tried to have a big outreach program. I was lay leader 30 years ago, and our minister had a friend who had started a medical clinic, and he asked us if we would be interested in trying to do that here. And of course we said yes, and it was good to involve some other churches. So we involved 2 other churches. One was Covenant Presbyterian, and one was Webb Chapel United Methodist Church. When we first started, it was really hard, but there was a lot of excitement that we were doing something that we wanted to do to help other people. So from the very beginning, it was accepted from the 3 churches as something that was meaningful. And of course, it started out being called On Eagle's Wings, which is a scripture from the Bible. We had a generous physician that gave us an office, and we had several doctors and nurses who volunteered to give their time to help. So we contacted the school district and the various hospitals and things and said, you know, we're here, we're trying to get this going. And so one day a week, the volunteers came and we got the references and started very, very small.
The clinic was up and running and doing very well by the time I came on board. It probably took about 50 volunteers a month to keep the clinic going once a week. From the time I started at the clinic until the time I left, we had doubled in size, not just the number of people, but in the facility.
So in 1992, we started as On Eagle's Wings, and that lasted for quite a while. And then we changed to Metrocrest Community Clinic. To now, we changed and we will remain Woven Health Clinic.
I think the clinic's been successful in its willingness to adapt. We made a transition and hired our new clinic director about 8 years ago. And as part of that process, we kind of changed the direction of the services the clinic provided from episodic care or sick care for patients to more disease prevention.
We haven't changed what we do. It's healthy lives and healthy communities. We've just added services. Now we are behavioral health, and now we have nutritionalists, primary care, mental health, disease health, women's services. It all is woven together.
To really get something like this off the ground and running all of these years, it's just incredible.
Well, I'm very proud to have been a participant in the community clinic and seeing it grow and expand, provide additional services over the past 10 years that I've been involved. And it really is a sense of fulfillment.
We've always felt like the clinic was special. We felt like it was God-driven because of the way that it started and the volunteers that we got, the doctors, the nurses, the helpers. Everybody was very proud of the fact that it started here.
I am really very pleased to see how far they've come. It makes me very happy to know that I was a small part at the very beginning.
I think evidenced by the fact that the clinic has been in fruition for 30 years indicates the need and our successful fulfillment of that need.
Looking back over the last 30 years, when I think about the clinic and our legacy going forward, it really is about strength and hope and vision and leadership and all of those things woven together to create what we have today. I just think we're blessed. It really is about the love of our fellow neighbors and to improve that community.
My health just was getting worse, and anxiety levels started rising, due to the stress of not being able to get health care.
I had been about 3 or 4 years without going to a doctor. It was very stressful, not having anywhere to go.
when I think about this place, I think, they saved my life.
Our mission is to deliver comprehensive, quality, affordable health care to those people that can't afford it and desperately need it.
It's hard. It's hard to take care of yourself. If you can't take care of yourself, you can't do your job, you can't take care of your kids. And it's very important for Woven Health Clinic to be here. If it wasn't for them, I don't know what would have happened to me.
For me to have insurance with all my pre-existing conditions, it would take about 75% of my salary per month.
When I discovered Woven Healthcare Clinic, I was just amazed and surprised, of I could find everything that I needed in one place. And not just that, but close to home at a very, very inexpensive price.
My health was to the floor. Now that I have been coming to Woven Health Clinic, I'm on my medications. I've been taking care of myself. I have lost a lot of weight. And you know what? It's going to be more changes, but with their help, I'll get through it.
I cannot imagine my life without Woven Health Clinic. I would feel like in a desert without water, honestly.
I couldn't imagine my life without Woven Health Clinic. I don't know. I'm pretty fairly sure I would not even be alive today because I would never have been able to afford my medications.
You can see me smiling now. I feel so much happier, and everything thanks to the care and given at Woven Health Clinic. So I'm very happy.
Woven Health has been a powerful, powerful help to my life. It's changed me and physically, mentally, and health-wise.
I've got a job. It's not like I've been unemployed. And I can only imagine what it's like, especially now. It's not easy. It's not easy for me to pay my rent at the end of the month, but I've been able to survive. But if it hadn't been for Woven, that would not be the case.
If we didn't have Woven Health Clinic in this community, it would tremendously hurt the community.
To the people that support Woven Health Clinic and all of you that donate the money and make this possible for low-income community people like myself, I really want to say I'm grateful. I thank you. Thank you, thank you. Please keep doing it. You've made one person very happy, one person healthier, and it's all thanks to your help.
We have a dream. Everyone deserves the kind of care that Woven delivers. And our dream is to put Woven healthcare clinics across the United States. And we need your help. So you can help us save lives, build healthy communities, and get this type of care to more people. Thank you.
That was a really, really dark time because I just didn't know what the hell was going on. I have 4 amazing kiddos. They are my saving grace. They're pretty much the piece of me that I would never, ever trade for the world. They changed my life each in all different ways, and I'm very thankful for that. So growing up, I was the youngest out of 4. Just did my own little thing. Always was either my brother's little sister or my sister's little sister. Never really like my own person. Just trying to fit in, trying to be a different person than what I was. I meet this guy and I end up dating, and I have my first child by myself. Shortly after that, I was raped by my kid's father. I didn't tell anybody but my sister and my best friend. And my sister thought I was lying. I really went through a dark time because I'm pregnant and I'm like, okay, how am I gonna make my life work? I'm gonna have 2 kids and I'm gonna be raising them by myself. Eventually, I really, really started contemplating wanting to die. I ended up changing jobs and I'm working at another job, and I meet this guy. 3 years in, I found out I was pregnant with my other son. Right after the baby is born, he almost put me through a wall in the house. Like a week after the baby was born. He is upstairs telling my older kids, "You better not ever listen to your mom, she's a dumb..." I just kept taking the abuse. Yeah, that was very intense for me. It was like, oh, I'm so sad, I'm not happy in myself. I'm gonna keep searching until I feel happy, until something fulfills me. And so I ended up filling a bunch of voids with stupid stuff. It was really like drinking, smoking, having sex, just kind of trying to cope with what I had went through. Well, me and my sister decided that we were gonna go on a momcation, right? I just need to get away for a little bit, and so I leave and I go to Las Vegas, and I'm like, oh my gosh, I'm on a plane for the first time. I'm not gonna miss my kids at all. It's supposed to be the time of our lives, but I'm absolutely miserable. I just wanna go home and be with my kids. When I got home, I gave my kids the biggest hugs ever. And I was like, Mommy missed you, and I'm never gonna leave you guys again. And then a week after that, I called Woven Health, and I was like, I need to get my blood pressure in check. So I went into the doctor, and she's looking at my blood pressure like, girl, we're gonna put you on some medicine. She's like, so how do you feel? Like, you know, we have mental health services. And I was like, well, I'm definitely looking into that too. A week later, I was sitting in Lizette's office.
She was very motivated that she did not want her children to have the same kind of relationship history that she did. One thing I always mention to my patients, and it's something I mentioned to KD, is like, if you aren't unable to take care of yourself, how are you going to be there for your children when they need you? Especially if they are going through something that is very traumatic for them. A lot of the time in many cultures, such as the Latino or African American, mental health is not spoken about. Unfortunately, even though it's not spoken about, it still happens. It affects your ability to eat, your motivation to do things. That's how depression will sometimes affect people. Things that they were able to do easily before, just not possible right now, because it affects you physically and mentally to the point where some people just can't get out of bed. But because of that stigma, they don't want to reach out for help. When I first met Katie, she was been doing well, and then she got to the point where it was just so overwhelming that she just couldn't handle it anymore. There was just a lot of new stressors. Woven Health Clinic was able to become a support system for KD because she knew what she wanted, just like a lot of our patients know what they want. She is definitely making wonderful strides, and she is becoming that mother that she wants to be, that wonderful mother that loves her children no matter what and is going to strive for them and make sure that she can take care of herself and them in the future. So she's doing wonderful.
At first, I was like, I don't know how I'm gonna ever see the light. I didn't just realize how important mental health was for me. I realized how important it was for my whole family. I had a bucket full of artwork that I was scared to release. Lizette helped me. She was like, hey, I wanna see you get this stuff out there. And that really helped me break through that moment and be like, you know what? I can do this. And so I released it. I opened my Etsy business and I put it out there online and people can buy it. And I'm so proud of myself because that was something that I didn't think that I could do.
It was a bit rocky for her at the beginning, but that's how mental health is sometimes. It's a very rocky road, but it's gotten to the point where it's smoothed out a lot for her. She'll be able to go to a lot of different places with everything that she's been able to do. So I'm very proud of her.
Woven just really took me underneath its wing, not just in my medical health, but in my mental health, emotional health, my family relationships. It has truly, truly given me hope.
Oh, hi there. I don't know what's going on. I was feeling fine this morning, but now I can't seem to stop coughing.
John, honey, are you okay?
John has a cold. It's just a cough, babe. Probably a cold.
That sounds pretty bad. Doesn't sound like just a cold.
Not just a cold? What do I do if it's not just a cold? It's been years since I've been to the doctor.
Why don't you try the urgent care right up the street? They should be able to see you today.
It's a good idea. I need something fast. I cannot miss work. Simply not an option.
All right, Jimmy.
Oh, it's John.
Here's a prescription. You can see Janice on your way out for your bill.
Oh, wow. Actually, Doc, I'm allergic to this particular drug.
Okay. Did you try cough drops?
What did you say?
Oh, shortness of breath? That could be serious. Unfortunately, James, I can't help you. Maybe try the ER.
Well, that was fast, but ultimately, thoroughly and completely unhelpful. Also, what did I just pay for exactly?
A doc who doesn't know your name, an ER referral, and prescription cough drops. Drive safe, honey.
Whoa, buddy. You have to sit right there? You know?
John!
They got my name right. Dude.
We've totaled up your bill for today's visit, and it comes to $10,000.
What?
And your firstborn child.
You're not taking
What
this.
is a good mailing address for that bill?
Wow. What a nightmare. I mean, I'm gonna really miss Harrison, but I guess at least my cough is gone. You know, there has got to be a way to get quality, affordable, and timely health care.
What about that place your friend Damien always talks about? Woven Health membership?
That's it. I knew there was another way. I think you're onto something, honey. Let's try that again, shall we? Oh, Elena, I think I might have a cold.
That sounds pretty bad. Why don't you talk to our doc at Woven Health? I got you an appointment for tomorrow.
Oh yeah, you heard that right. Elena and I signed up with Woven Health's membership 6 months ago. It's been great. One of the best parts is that I can be seen within 24 hours with a simple call, a text, or even an email.
Hi, John. Here's your prescription that you're not allergic to. Also, I noticed a couple things on your health screening that we'd like to look into. Let's have you see a mental health specialist and nutritionist before you leave, okay?
It makes a world of difference knowing that they know my medical history and my name. Woven is all about treating someone's physical and mental health needs. They call that treating the whole person.
You're feeling stressed, John? Tell me about that. What makes you so anxious about missing work?
Not only does Woven pay attention to my physical and my mental health in the present, they also care about my health in the future. They want me to make healthy lifestyle choices now that will help me avoid big health issues down the road. They call that preventative care.
John, I hear you're drinking multiple sodas a day. Give me your hand. Let me show you how much sugar is in one of these. That's how much. Let's talk alternatives.
See? That's what I mean. They work with me to help me create a healthy lifestyle. It gives me such a peace of mind to know that they are here for me when I need them and that they truly care about me.
Hi, John. Thank you so much for coming in today. I hope you enjoyed your visit. There will be no charge. It was all covered by your membership.
Yay!
Since the cost of Woven's membership is nearly 10 times cheaper than any insurance plan, it's affordable for people with high deductibles or even people with no insurance at all. like me, and for employers like my friend Cecilia.
All right, guys, I have a special announcement to make. I'm getting all of us a Woven Health membership.
Oh, wasn't that healthcare experience with Woven Health so much better? I have all these options at my fingertips now. Telemed, text, email, and in-person visits within 24 hours of contact. And it's all included in my Woven Health membership. Whether it's just a random cough, a routine checkup on my physical and mental health, or even just teaching me how to live a healthy lifestyle, I know I'm covered by a provider that cares and that actually knows my name.
Hey, John.
Hiya, Doc. I think it's safe to say that Woven Health has had a positive impact on my life and my entire family, for now and for years to come. Thanks to Woven, John doesn't have a cold anymore. And John finally has real health care. Hey, honey.
Hey.
I can do this all day.
Years ago, Woven Health was founded by 3 local churches and community volunteers with a passion to serve those that could not afford health care. While many things have changed over the years, hiring full-time staff, expanding services with primary care, women's health, disease prevention, and mental health, adding a second clinic, and now introducing our new membership model, what will never change is our determination to serve those that cannot afford health care. This is a challenging year for Woven. Federal funding, which made up half our budget, has dried up. We had to find new sources to provide the foundation for the next 30 years. At the same time, the number of people who cannot afford health care is exploding. We decided to do what we do best, provide quality health care for a low-cost monthly fee. Our new membership model does 3 important things. First and foremost, it allows us to continue our mission, serving low-income patients just like we always have. It also provides 80% of our funding to make us more financially sustainable. And it allows us to expand services to small businesses, people with high deductibles, and the self-employed. Woven Health is a patient-centered medical home that delivers quality, comprehensive care. As a nonprofit, we can do this at a low cost for the right reasons, providing both patients and providers a better experience. But it will take time and resources to build our new membership model. We need your help now. At Woven, 92 cents of every dollar goes directly to providing health care. I ask that you please consider making a donation to help keep our clinic doors open and seeing patients. Thank you.